New England Journal of Medicine study. Time-restricted eating is the best first intervention for all modern chronic diseases. Dr. Mindy Pelz, Dr. Shawn Baker.
Came out of the New England Journal of Medicine, December 2019, and they looked at over 1,500 peer-reviewed journals, and they decided that intermittent fasting was the absolute best way. They even went on to say it should be the first way for these conditions, for obesity, diabetes, neurodegenerative conditions like Alzheimer's and dementia, some cancers, not all cancers, primarily the hormonal cancer and colon cancers, MS, and pre and post surgery, cardiovascular health too. Not difficult to do. You just got to train your body how to do it. You're going to really want to lean into nutrient dense food. And when you eat, you want to eat. This is why when people say calorie restriction, so especially in women and fasting, there's a lot of discussion around the fact that it's too much calorie restriction. But it's not calorie restriction. It's time restricted eating. So when you eat, you're going to need to eat, and you're going to need to eat good quality food. This is why I love pairing something like the carnivore diet with fasting, because you're getting such nutrient dense food in that eating window. Now, beyond that, what I hear from a lot of people is, well, I'm not hungry. And this is probably the biggest challenge, because when we move over into this ketogenic energy system, ketones turn off hunger. So you are going to need to learn in your eating window how to eat the right foods, regardless of if you're hungry or not. And again, this is why meat is a great thing to pair with your fasting. Beyond that, we might have to look at some things like supplementation. So we live in the most mineral depleted time we have ever seen humans have. Our food is not being grown in soils that are rich in minerals. We've got so many chemicals in our environment that are blocking mineral receptor sites in cells. So you might have to add in a mineral supplement. Most of our fasters in my community do. So you might have to supplement a little bit more to get those extra nutrients, but you got to train yourself to eat in that window. And the more nutrient dense, the easier it will be for you.
New England Journal of Medicine study. Time-restricted eating is the best first intervention for all modern chronic diseases. Dr. Mindy Pelz, Dr. Shawn Baker. In this meta-study, December 2019, 1,500 peer-reviewed studies, intermittent fasting or compressed eating window is the best way and should be the first intervention for modern chronic diseases such as obesity, diabetes, Alzheimer's and dementia, hormonal and colon cancers, muscular sclerosis, pre- and post-surgery, and cardiovascular. Dr. Pelz says, it's not difficult to do, you just train your body how to do it. You will want to lean into really nutrient-dense foods. It is not calorie restriction. It is time-restricted eating. You need to eat good, quality food. She says, that is why I love pairing carnivore with time-restricted eating. A lot of people doing this approach say, I'm just not hungry. This is a big challenge because the ketogenic eating system generates ketones, which turn off hunger. You need to learn to eat the right foods, whether you're hungry or not. She says, this is why meat is a great thing to pair with your time-restricted eating. You may need supplementations. We live in a mineral-depleted time. Food not being grown in mineral-rich soil. Chemicals in our environment block receptors. You might have to add mineral supplements. She says, train yourself to eat in the eating window. The more nutrient-dense foods, the easier it will be. Annotated and summarized. Easy to share with loved ones. To view and print these summary notes, see the description below the video title. To view and keyword search this channel's hundreds of videos organized by topic and by doctor, go to doctorstotrust.com.